I'm Pat Armstrong. I live in Leighton Buzzard in Bedfordshire and I have a colostomy. In December in 2003 I had some very bad rectal bleeding. Visit to the doctors, collapsed in the doctor's surgery and was then taken to hospital. And in 2004 I was diagnosed with a rectal cancer. I was determined that I was going to take things slowly. The early months, years of my cancer journey, let's say, was quite restrictive at times because even housework, like changing the beds, I used to have to do little bits at a time. When we had the grandchildren come in, they would like to go 10-pin bowling. And I used to love playing that. I wasn't only good at it, but I enjoyed it, so I had to restrict myself. And I did have a word with the stoma nurse and said, would it be all right? Well, as long as you don't go every night sort of thing and take it carefully, don't pick the biggest ball there is, you'll be all right. So everything was in moderation.
Once patients have fully recovered from their stoma surgery, they can return to normal activities. Patients who undergo colostomy formation from their surgery usually don't require dietary advice. However, some patients may be affected by different foods in terms of how it affects their bowel function, and that is something that the patient could discuss with their stoma nurse. Intimacy and sexual activity after having stoma formed is obviously a very personal thing for the patient involved, but they shouldn't be afraid to resume sexual relationships when they feel comfortable and they have no discomfort.
Life does go on. It doesn't go on the same way as it was before, but it's a different path I'm treading now. But it's just as beautiful, it's just as wonderful, it's just as nice, it's just as rewarding. But it does take a little bit of time to get used to it, and it takes confidence to get out there in the real world. Nobody's going to know. You don't have to go into places where there's going to be a lot of people straight away. Just do things in little bite-sized chunks again and see how it goes with you in particular.